As yesterday's weather proved, the season of shorts and swimsuits is here, but what if you're less than thrilled with your legs? Well, this morning, Dr. Craig Schwartz from Vein Centers for Excellence is here to share some tips for preventing spider veins and varicose veins. So welcome to the show. What I want to know is what typically causes spider veins and or varicose veins?
Well, the causes of varicose and spider veins are variable, but the number one cause is family history or genetics. The number two cause is pregnancy. Number three causes trauma. Number four is hormonal influences. And number five is occupations or activities where one sits or stands for prolonged periods of time. So unfortunately, there's not a lot we can do about those first few.
Or a combination of any one of those five.
And most people do have a combination of those.
Well, what is the difference between spider veins and varicose veins?
Well, this is one of the big problems I face as a vein specialist because unfortunately, there's a lot of misinformation out there, not only in the general population, but even within the medical community as to what really is varicose or spider vein and how we go about treating those. Varicose veins are those veins that are dilated and bulging out by definition. Whereas spider veins are the tiny little thread-like, reddish, bluish, purplish, sort of linear little spider veins.
What I want to know is it even possible? Are there really things that people can do to help prevent vein problems?
Well, the answer is yes and no. As I said earlier, some of those things that cause varicose and spider veins are things we can't really do anything about. So one really can't prevent them. If you're going to get them, you're going to get them. But there are some things that we can do to help minimize their progression or even reduce the development. And as a group, we refer to those things as conservative treatment. It's a combination of compression, elevation, and exercise. By compression, I mean wearing the use of medical-grade compression stockings, which help keep the flow of blood in the legs so that one doesn't experience pooling. Elevation means that one should elevate their legs for maybe 20 or 30 minutes a day. And by that, I mean they need to be reclined with their legs up above the level of the heart. Sitting with your foot on the coffee table is not elevation.
It's not elevated, okay.
And exercise. Exercise is very good for the legs. When the muscles of the legs are working, they're helping pump that blood. So again, that avoids venous pooling. So exercise is very good. One should exercise 30 minutes a day, whether it's walking, biking, swimming, even just walking your dog around the block a bunch of times is good for the legs.
Now, how many people are actually affected by varicose veins? What's the number?
Tremendous number.
Yeah?
Yeah, probably well over 70% of women at some point in their lives will experience varicose or spider veins, and even upwards of 30% of men will experience spider veins at some point.
Now, weird question. Do spider veins or varicose veins, do they get worse as you get older, or are you just afflicted with them and then boom?
Yes, typically they will get worse over time. The thing about the development of varicose and spider veins is once they're there, that problem will not get better. It will not go away. It will not cure itself. At best, it will stay the same, but for most people, it will progress. So symptoms will progress. Certainly with varicose veins, they'll get larger, they'll get more prolonged. And unfortunately with spider veins, as one gets older, it's one of the things that does happen with aging. And so unfortunately, as you get older, you're likely to develop spider veins at some point.
If you've got vein problems, this is the man to see. Thanks, Doc. I appreciate it.
My pleasure.
You bet. All right, let's throw things over to Michelle.